This is the first I'm hearing of our DOSCON alert being linked to transmission, and severity. Based on what I've seen on your MOH website, basically the colors will change according to the WHO phases.
No.
So yes, it's in your website. In one of the flu
depends on how it's
reports.
crafted. I was responsible for designing DOSCON during SARS. I mean, I together with my colleagues,
right.
And we are familiar with WHO's tiering, and we are quite clear that at some stage we have to decouple, because WHO look at the whole world as one globe, whereas individual country must look at your own local situation. I think the first few levels of WHO, when you do not know how it will hit and who it will hit, I think it is quite natural that we follow almost lockstep, almost identical. But once a situation becomes clearer, and from phase 3, maybe between phase 3 and phase 4 onwards, individual countries begin to look at your individual, local, and your own regional situation, and you can step up or step down as per need. But the two parameters are well-known parameters: physical spread, attack rate, and severity, fatality rate. Those are key parameters. WHO themselves has not been static, because I've been watching their tier 1 to 6, and they introduce tiers as we go along. In fact, when the dust settles, I'm quite sure there'll be discussion next month at Geneva. And if you ask me, I would suggest to them that their current 06 to 6 is probably too limited, because it bogs you down, you see, and you are fearful of overreacting, and you may likely end up underreacting. Whereas when we formulate our color scheme, we were more careful. Perhaps the SARS experience was helpful, so that we know that for example, the equivalent of 6, we have 3 color shades really. Although it's red and black, actually our red has 2 levels, red 1 and red 2. We didn't want to confuse public with all these details, and because they get all totally confused. But internally, we know this is what it's all about. Yeah. But I think for your readers, I think these two concepts is easy to explain. We worry about attack rate, we worry about fatality rate. And if both are high, we should be very, very worried. If fatality rate is high, that is frightening, like happened during SARS. But if fatality rate is low, but attack rate is high, then I dare not say we should be relaxed, but at least then it's just like normal flu, seasonal flu. Yeah.
I think, Mr. Khaw, then it comes back to the question that was asked last week. Essentially, were we too quick to react in that kind of manner?
Yes.
And were we simply being too kiasu in this whole thing?
No. The first, as I explained just now, the first 3 phases, you have to be very quick. Because if your public health measures to be of any effect, it must be quick. It must be overreacting. You must not underreact. But you cannot overreact forever. Then you cause problem or cry wolf. Because if you can guarantee me that this is a 1 month affair, 1 week affair, yeah, maybe we can sustain this at a level. Working whole shift with N95 on, it's not a picnic, because some of us went through that. And so that's one. And our staff, I think if they see patients really in the midst, people dying, and they as happened during SARS, they were able to, to put all this discomfort aside and struggle on. But when they see no patients, but if it's just a decree from us saying that please do all this and do all that at high alert 24 hours, all your leaves are cancelled, June holiday, say sorry to your kids, I think that is difficult. And when it is difficult and when people begin to ignore it, that is when trouble will start. Then when it really needs to really upgrade to red 1, people will say, no, it's not true, it's not probably not necessary. That is where you get into trouble. So I've been trying to figure out why in the past these waves and second wave becomes more lethal. I suspect it has something to do with complacency, because the first wave is mild, and then guts go down, and and so on. Then when the real stuff comes, you are not ready. So we have to take that into account. And because the next wave may come in many months' time, and it's just not possible. So if we need to maintain orange throughout the next 6 months, if it's clinically indicated, we will do so. And I'm quite sure our Singaporeans, will take it in their stride. But when there is strong evidence that it may not be necessary, then we must be prepared to reduce it. Yeah, that is how you should read this change the last few days. I think orange last week was correct. Yellow, beginning of yellow this week is also correct. Yeah, because at the end of the day, we are talking about risk management and probability. And of course, with more information, you can be more confident. But even today, we don't have full information.